According to the Gale Encyclopedia of Medicine, over 20 million have already been infected. And this year alone, 6.2 million individuals will become infected. The disease is so very prevalent that half of all sexually active men and women will contract it at some point in life. This is the most prevalent STD in America. Which sexually transmitted disease are these statistics referring to? Do you know? If your response was the human papillomavirus, you're correct. Today, I'm going to talk to you about the importance of the human papillomavirus, or HPV, prevention and treatment, how it applies to you, and what you can and need to be doing about it. Dr. Mary Pickett states that HPV is the leading cause of cervical cancer. HPV causes almost all cervical cancers and genital warts. It is highly contagious, and it is spread by genital contact. Between 20 and 40% of teenagers test positive for exposure to HPV, and 40% of all women ages 20 to 29 have prior or current infections. So as you can see, this is something that is very relevant and something needs to be done about it. Let's look at this example. If we saw a small child in the middle of the road and we saw a car coming, what are we going to do? Move the child, right? So just imagine the car as HPV and the child as ourselves, or as teenagers. As our teenagers, we're not just gonna sit back and watch the car hit ourselves or our teenagers. We're gonna be proactive. We're gonna move out the way, or we're gonna move our teens out the way. So let's not let HPV hit our society without doing anything about it. We're gonna do something starting today. To say that I want to give you a method to eradicate HPV infections in one day is not realistic, or even in 1 year or a lifetime. It is going to take decades to decrease the infection and increase prevention and awareness in our society. I could try to start a program that is anti-HPV, or I can come up with some little cute rhyme that reminds you of how relevant HPV is in society. But what I think is most effective is giving you the prevention methods and leaving it up to you to do something about it. But before we can prevent, we have to be educated. We have to understand what HPV is. So if you're a parent, it's your job to educate your children on what HPV is, the consequences of starting to engage in sexual activities earlier in life. I know that this is tough to do, especially with young children, but tell your preteens about it. Educate them. Um, after you finish educating them, make sure you educate yourself. If you're not a parent, know what HPV is and know how it is affecting you in your life. After education, here comes the proactive step, and you got it. It's prevention. The only 100% satisfaction guaranteed method of prevention is abstinence. It's the only sure way of steering clear of any STDs, but in today's society, we all know that we have to teach other methods of prevention. According to the Centers of Disease Control, there are two preventative vaccinations. It's Cervarix and Gardasil. Gardasil has been proven to prevent HPV types that cause most genital warts, and it also prevents cancers of the anus, vulva, and vagina as well. Both these vaccinations are 3 shots given over a 6-month time period. 3 shots in 6 months is small as compared to trying to treat cancer over your lifetime. The vaccination can be given starting at the age of 9. Parents don't have to leave it up to their children to say that they need some kind of protection when they get into their teenage years. Go ahead and take them when they're 9 years old. As soon as they're of age, get it taken care of. It's not saying that you're saying premarital sex is okay, but you're protecting them just in case, you never know what goes on. The Health and Wellness Resource Center states that other preventative methods are reducing your number of sexual partners, using condoms regularly during sexual intercourse. There are also other programs in place right now that have been able to give the vaccination for free, so don't let financial restrictions be a problem. So all these methods are doable. You're probably wondering, how is this going to be effective? All you did was tell us what it is that we can do. If you're looking for an immediate reward situation, this is not it. This is going to take time to show a reduction in infection rate. I chose prevention as my intervention because I know this will work. We could come up with all kind of different programs, but it's all up to the individual. So, nothing beats educating yourself and your children, and people who don't have children. You have to know what HPV is. The shot is available up until 26 years of age. Get the shot. Take care of yourself. America will benefit from these preventive measures if we do what it takes. Be committed to doing it. A recent study has already showed that substantial decrease in HPV infections have happened in the community setting when Gardasil was applied. If we choose not to take these actions, then millions will continue to be infected and cancer will be real in our society. I hope you guys have learned the importance of HPV and inform others. Get your children tested, get yourself tested, get yourself vaccinated, use condoms, reduce your sexual partners, and if you're really strong, abstain. We are so very capable of making a difference. We just have to become the change that we want to see. Don't wait until it's too late and you're having to spend your life treating cancer as opposed to just taking 3 shots. 6.2 million people will become infected this year. Will you be one of them? I wouldn't leave it up to chance if I were you. I'm Kiana Boykin, and I hope you guys will do what it takes to prevent HPV infections in America. Thank you.